Thank you, Katie, and welcome everybody. Thanks very much for coming today. You may not realize it, but this guy right here you just heard from will probably be responsible, he and others working to develop these vaccines, in something that prevents early death in millions of people over the next 30 years. It's really a remarkable opportunity we have to prevent so much suffering in our society. And the problem we as clinicians see is that we're missing out on this opportunity. Our vaccination rates lag far behind. And I would say we have quite a young audience today, and remember, it's not too late to be vaccinated. So many of you in the audience are at an age that you could still get the HPV vaccine, and I wish you would, consult with your physicians about that. So I've been asked to give an overview of the campaign and an overview of the survey that's been done across the country about a little bit about why we need this campaign and where we can direct our efforts. So the focus, as Bo went into earlier, is really about human papillomavirus, HPV, as well as hepatitis B and hepatitis C. And the goals are to raise awareness of the link between these viruses and several cancers. I'll just go ahead and mention those again. Liver cancer for hepatitis B and C, and then for human papillomavirus, HPV, cervical cancer, as John just talked about, but also oropharyngeal cancer, cancer of the throat, cancer of the tonsils and the back of the tongue, not the part of the tongue you can see, the very back of the tongue. And then anal cancer, penile cancer, and some other genital cancers that are associated with these cancers, with this virus. Secondly is to raise awareness that these cancers essentially are preventable. We could eradicate these cancers that are related to HPV if we get our vaccination rates up high enough. And if we can treat patients diagnosed with hepatitis C, we have an opportunity to prevent many liver cancers. Next, the awareness of the effectiveness of these Hep B and HPV vaccines. They're highly effective at preventing infection with these viruses, and the effectiveness of Hep C treatment. In the green box there is just sort of the three main public outreach efforts we're having. One is that the community needs to think about the link between these viruses, that vaccination and treatment can prevent cancer, and for encouraging people to make an appointment with their doctor or their child's doctor to discuss this need for vaccination. The outreach of the campaign will be concentrated on the states as you see here. You can see a little bit more in your packets that y'all have been provided, and the details of the survey in the packets you've been provided. The states in light blue are focused about HPV vaccination. The states in dark blue about hepatitis B and C education and vaccination. And then these are sort of chosen, these were chosen based on high cervical cancer rates, low vaccination rates, high liver cancer rates. So there's a reason that these states were sort of chosen as where to focus the campaign. The survey, which is sort of assessing where we stand, as Bo mentioned, over 600 healthcare professionals were surveyed through an online survey by the independent survey firm called, their name is Russell Research. Over 600 physicians and healthcare providers and over 1,000 general adult population were surveyed. The purpose was to understand familiarity with the link, perceptions about the link and perceptions about vaccination, and behaviors people have towards getting vaccinated and being screened. Measure virus and vaccine familiarity where the objective one, evaluate vaccination recommendations, the education methods used by healthcare providers, the strategies for compliance and barriers against compliance in the healthcare community, measure awareness of HPV, Hep B and C facts in the general community, and evaluate perceptions about vaccination in general. So first we'll mention the highlights from the healthcare professionals. First of all, not all patients who meet CDC guidelines are receiving their HPV vaccination or even recommendation for HPV vaccination. 3 of 10 pediatricians do not recommend HPV vaccination to all patients who qualify. Again, as John said, it's 11 and 12-year-olds. That's when kids are supposed to be vaccinated, both boys and girls. So almost a third of pediatricians aren't routinely recommending this to all those kids that fall in that age group. 2 of 3 general practitioners, in other words, almost 2/3 of general practitioners are not recommending vaccination to kids who fall in that proper age category. That's pitifully low. 3 of 5 nurse practitioners and physician assistants are not recommending routine vaccination to the appropriate age categories. Now, why are the healthcare professionals not always recommending HPV vaccination? The top 2 reasons provided in the survey, again, over 600 healthcare providers. First, parents being uncomfortable with this vaccine, and then patients reportedly being too young for the vaccine. What's concerning is 1/3 of healthcare professionals and 1/4 of pediatricians specifically did not feel that kids age 11 and 12 were appropriate age for HPV vaccination, which is counter to the CDC, our national recommendation, and what's used in all countries as far as vaccinating kids. They felt that those kids were too young. Now, how about hepatitis B vaccination? Why would healthcare professionals, what were the most common reasons they were not recommending Hep B vaccination? Firstly is that their adult patients were not at high risk. And secondly, that parents being uncomfortable was an issue brought up in almost 40% of the time. And then finally for Hep C. Hep C is a treatable condition, and only 3 in 5 patients diagnosed with Hep C are presently ultimately receiving treatment. What's a real disappointment, this is a curative treatment. If you can cure Hep C infection, you prevent cirrhosis and then the later development of liver cancer. Liver cancer is a horrible cancer to contract, and often people die of that once they have liver cancer. So just having Hep C, it's treatable. This was not treatable when I started medical school. It's a treatable condition now, and only 3 in 5 are actually getting treated. The most common barrier to getting Hep C treatment has been reported by the healthcare professionals as the cost of treatment. I'm sorry, this is kind of small to read, but it's cost of treatment and the lack of insurance coverage. So it's a availability and cost issue. Now, 70% of healthcare professionals say that cancer prevention is a very or somewhat works very well or somewhat well for advocating for Hep B vaccination to their patients. However, only 27% of healthcare professionals are actually using this routinely to discuss with their patients about why they need to get hepatitis B vaccination. Now, how about the survey highlights from the general population? Less than half of adults are very or somewhat familiar with hepatitis C, HPV, and hepatitis B, just as a virus, as a healthcare problem. And fewer than 1 in 7 report that they're very familiar with these infections. Only 1 in 5 adults are very or somewhat concerned about increased risk for HPV in themselves. And fewer than 1 in 6 are very or somewhat concerned about hepatitis C and B infection. Many adults in high-risk population never have been screened in the past. Only 3 in 10 Asian Americans have been screened for hepatitis B. Only 1 in 4 Hispanic Americans have been screened for hepatitis C, and only 1 in 5 have been screened for HPV. The use of cancer prevention by their physician has been a rarely used strategy. Only 7% of adults say that their physician has recommended one or more vaccinations to specifically reduce cancer risk in themselves. More than 9 in 10, on the other hand, more than 9 in 10 adults believe that more education is needed about the dangers of HPV. 4 in 5 adults feel that they would more seriously consider vaccination if their physician had discussed the benefits of vaccination with them. And 4 in 5 adults would be more likely to get vaccinations if their physician had provided more detailed information. And finally, large percentages of at-risk populations do not know they're at risk. Only 1 in 8 Hispanic American adults, that's 12%, were aware that Hispanics have a higher rates of hepatitis C associated liver cancer. Only 1 in 9 baby boomers, 11%, were aware that baby boomers have a higher risk of hepatitis C. And nearly 3 in 10 only 3 in 10 Asians were aware that Asian Americans have a higher rate of hepatitis B. So I'd like to close with 2 slides about some of the things that I deal with. I'm a head and neck surgeon. I deal with throat cancer, oropharynx cancer, and the problem we're seeing across the country. If you look on that graph to the left, you see the yellow line that's trending down. That's cervical cancer incidence rates, the number of new cervical cancers per population that we're seeing each year in the United States. And as John said, cervical cancer screening works very well. Since the Pap smear was brought into existence back in the 50s, we've seen cervical cancer go from one of the top 3 cancers among women to relatively rare cancer among women. The blue line represents oropharyngeal cancer incidence among men in the United States, and you can see it's going up. 2010, the 2 lines crossed. And on the right-hand side shows you the number of cases. We now have, in 2016, more oropharyngeal cancers in men each year than we have cervical cancers in women. The problem with this, one problem with this is how this shows up. It shows up as a lump in your neck. It's typically a man in their mid-50s. No symptoms related to their tongue or their throat. No sore throat, no pain in the throat, no trouble swallowing. They cannot see it. They show up with a mass in their neck. Typically, when we do the CAT scan, they have multiple masses in the neck. What that means is the cancer is already spread. And in 80 to 90% of these cases, it's stage 4 when we see the patient. And the treatment for this is intense. It's chemotherapy and radiation for 6 weeks, 5 days a week for 6 weeks. Half the people lose the ability to swallow during that treatment, have to have a feeding tube placed in their stomach. It is an extremely costly treatment, and the effects are lifelong. We do have treated at major cancer centers very good results with this type of cancer treatment, but it's a hell of a thing to undergo and to suffer with. And while we can screen for cervical cancer, and this is basically how you do it, you take a little swab to the surface of the cervix and you can sample the cells, and they can tell if those cells are abnormal, or as John pointed out, just test for HPV. And that's how you know that woman has an increased risk for a precancer or an early cervical cancer. And then it can be treated early on with local therapies. The problem with the oropharynx is our throat looks like this on the right. It has these little crypts, these little pits in our throat, in our tonsils, in the back of our tongue. We cannot see these cancers. Most of these patients, even that show up when they have the lump in their neck, a general doctor looks in their throat, won't see anything. Even when I look in it, a fair percentage of those patients, I can't see where the cancer started. I have to go do some special exams to actually identify where it started. So we do not have a way in the near future, I don't think we have a way in the near future we're going to be able to screen. And again, these are men getting it, men and women, but typically more commonly men in their 50s. So what I'm telling you is, even if we were to vaccinate 100% of our boys in 2009, when the vaccine was approved for boys, we would not see decreasing rates of this cancer till 2040. So the more we've delayed, the greater the problem we're going to have in the future. And your generation, many of you in the younger generation, beware of this, and I would like you to really reach out about getting yourself vaccinated if it's still available for you. So with that, I'll close with my part, and thank you very much again for attending.